everyone. It's 3:30 on Thursday, April 23rd, 2020. Thank you for joining us. I am Janet Hill with the Rock Island County Health Department. Today we have with us Nita Ludwig, the administrator of the Rock Island County Health Department, Ed Rivers, the director of the Scott County Health Department, and Kristin Bogdonas at the University of Illinois Extension. They are all here to give brief prepared statements and then answer your questions to the best of their abilities. One note, that Governor Pritzker's media conference is ongoing, and we are not prepared to talk about what he has announced extensively, other than we know that the stay-at-home order in Illinois has been extended until May 30th. We ask that you direct your question to the person you're addressing in the chat box. The question and answer section will be moderated by Brooke Barnes of the Scott County Health Department. Nita, please start us off with your reporting of Rock Island County's case numbers. Thanks.
Thank you. So today, Rock Island County Health Department is reporting 18 new COVID-19 cases. They are all isolating at home, and that brings our total to 320 cases for Rock Island County, and we are still at 6 total deaths for Rock Island County. There are currently 25 people hospitalized at this time with COVID-19 illness.
There was an increase of 5 cases in Scott County for a total of 188 announced today. My comments today are brief, but they've been of great interest to those in our community and in the news. There's much discussion on when various parts of society can reopen to allow people to get back to work, open shops, and begin providing services. However, remember that our community has likely not experienced our peak of COVID-19 spread. Generally speaking, each community is on its own timeline for the spread of COVID-19 and will have its own timeline for recovery from COVID-19. Today, Governor Reynolds indicated that discussions currently occurring may lead to loosening restrictions and reopening businesses, but this could occur on a regional or even an individual county level. As Janet noted, Governor J.B. Pritzker announced today that Illinois' stay-at-home order will remain in effect through May. So please continue to listen to the messages that are coming from the Iowa and Illinois governors, from the Iowa and Illinois Departments of Public Health, and from the Scott and Rock Island County Health Departments to help understand what is currently taking place in our community and where we're headed in the upcoming days.
We'll now hear from Nita Ludwig with Rock Island County Health Department.
So you've probably seen the wild information going around social media about COVID-19. Most of it probably isn't completely true. We all owe it to each other to tamp down misinformation. Do your part to stop the spread of rumors by doing 3 easy things. Find trusted sources of information, share information from these trusted sources, and discourage others from sharing information from unverified sources. To find trusted sources, look for the information from official public health and safety authorities. You can find many official sources at coronavirus.gov. Both the Iowa and Illinois Departments of Public Health and the Rock Island and Scott County Health Departments are all putting out trusted information on their websites and social media accounts.
Thank you, Ed and Nita. We'll now go to the chat, please. I'm so sorry. Kristin Bogdonas will now be talking with the University of Illinois Extension. Sorry about that, Kristin. Why don't you go ahead with your talking points as well?
All right, thank you. Good afternoon. This is Kristin Bogdonas, nutrition educator with the University of Illinois Extension, and I'm going to talk a little bit about food safety at home as it pertains to deliveries and takeout. So current guidance from the Food and Drug Administration states that there is no evidence to suggest that food produced in the United States can transmit COVID-19. However, home delivery of meals presents a potential risk. There are several things we can do to ensure our food stays safe when ordering takeout and grab-and-go meals. As always, it is important that food safety steps such as sanitizing, safe food handling, and storage are also followed during this time to prevent foodborne illness. So first, I'm going to share some tips on how to keep food safe with takeouts and home deliveries. So you can ask for a contactless delivery and set up payment ahead of time. This can prevent transferring harmful germs from person to person. Take out food from containers or bags using clean silverware or tongs and place on a clean plate, bowl, or in storage containers before eating. Then dispose of or recycle takeout containers appropriately. And lastly, clean and sanitize all surfaces the packaging came into contact with. And you can learn how to make your own sanitizer at home, and resources. I have those at the end of the statement. The first food safety step I'm going to cover is cleaning. So it's important to wash hands with plain soap and water before eating for 20 seconds. Additionally, wash any surfaces that come in contact with food or what the food was picked up or delivered in. Rinse fresh fruits and vegetables that come with the meal, even if you're going to peel them. Use the clean vegetable brush to scrub firm fruits and vegetables like melons and avocados to get in those little grooves. According to the FDA, washing fruits and vegetables with soap, detergent, or commercial produce wash is not recommended. And as always, don't wash raw meat, chicken, turkey, or eggs. Cooking them thoroughly will kill the harmful germs. Second step in food safety is cooking and keeping hot foods hot. So if a meal is received hot, eat it right away or keep it hot at 140 degrees Fahrenheit or above until you are ready to eat it. Always use a food thermometer to make sure that food is at a safe temperature, and practice the 2-hour rule. Cooked food should not sit at room temperature for more than 2 hours. It only takes 2 hours for harmful bacteria to multiply to a quantity that could cause foodborne illness. So how can we safely keep hot food hot at home? You can move food from the takeout containers into a skillet, pot, or saucepan and keep the foods hot on the stovetop. You can use the oven, or you can place food in a preheated slow cooker to keep hot, but never reheat food in a cold slow cooker. The third food safety step is chilling. We always want to chill our groceries, leftovers, and food delivery items within 2 hours. If a meal is received cold, it should be kept at a temperature of 40 degrees Fahrenheit or below. And make sure to leave space for air to circulate between containers, fridge, and freezer to allow for rapid cooling and freezing to occur. So how can we keep food safely cold at home? Keep refrigerators set at 40 degrees or below and store items immediately in the fridge until use. And as always, check food temperatures using a food thermometer to ensure that food is staying at 40 or below. And the fourth step is reheating. If the meal will not be eaten right away, divide it into smaller portions and store in the refrigerator. Use shallow food-safe containers, no more than 4 inches deep, and use that thermometer to reheat foods to 165, no matter the food or method of reheating. Not all kitchen appliances are safe for reheating. Safe reheating appliances include the oven, stovetop, and microwave. And unsafe appliances would include the slow cooker and chafing dishes. And lastly, sanitizing can help prevent cross-contamination and spread of germs, but unsafe practices can be harmful and land you in a medical emergency. According to Illinois Poison Center data, exposures to cleaning products are up 30% compared to last year. As more people are sanitizing to stop the spread of COVID-19, remember to follow these steps when preparing and using home sanitizing solutions. Number 1, follow the manufacturer's safety instructions when working with bleach and other household cleaning products. 2, keep all cleaning products separate from food products. 3, never mix cleaning chemicals together. Examples of toxic combinations include bleach and ammonia, bleach and rubbing alcohol, bleach and vinegar, as well as hydrogen peroxide and vinegar. 4, keep small children and pets away from sanitized surfaces until the surfaces are dry. And 5, if you suspect you or someone you know has been exposed to a potentially harmful substance, please call the Illinois Poison Center at 800-222-1222. And then I have a list of some additional resources for extensions, response to COVID-19, and foodsafety.gov, as well as those handouts on how to make bleach sanitizer at home in English and in Spanish.
Thank you so much for joining us today, Kristin. We appreciate all of that information. As I mentioned, we will now go to the chat and answer any questions, so please type them in now. If we don't receive any additional, we'll go to conclusion. So the first question that we have is for Nita. It says Governor Reynolds of Iowa has broken out the number of positive cases among meat production workers. Is there a reason that you know of why Illinois has chosen not to release those numbers? And it says, I realize there are HIPAA privacy laws, but those are federal standards.
Sure. It has been the long-standing policy of the Illinois Department of Public Health not to break down those sorts of numbers and to only give aggregate data. So Rock Island County Health Department as well follows the lead of the Illinois Department of Public Health.
Okay, we'll give it a couple more seconds. Please type any questions that you have for the speakers today. Kristin, we do have a question for you. Are people going overboard with cleaning solutions?
That is what I read in Illinois' Poison Center article, and they were saying that there have been more accidental poisonings and people using chemicals to wash their produce, which we know is not necessary.
All right, seeing no additional questions, we're going to conclude. Again, we continue to appreciate you joining us for these topics. We know that a lot of our public health messaging is remaining the same because we know that our tools are staying home, washing hands, all of those things. So we encourage you to continue to share that as you can. We'll follow up with this one last question, and we see it there, so we're going to get to that one. Are there known cases of COVID-19 being transferred from takeout containers or packaging? Kristin, are you able to answer that question?
As far as I'm aware, there have not been any cases related to food.
We appreciate the tips that you provided about how to take the food out of the packaging and making sure to wash hands with that. So thank you again for sharing. Thank you to Ed, Nita, and Kristin for being on today. Thank you to everyone for joining us, and we look forward to speaking with you again. Have a good day.